We are excited to welcome our first speaker, Cara Coleman, who is a consultant and instructor of medical education at UVA Medicine Inova campus, as well as with Bluebird Consulting and the Bluebird Way Foundation. Today, Cara will be talking about care maps, ascending the peaks, navigating valleys, and connecting everything in between. If you'd like to learn more about Cara, I point you to the attendee website where you can read her full bio. I'd also point your attention to the slide here where you will see our continuing education statement, as well as Cara's learning objectives. Cara has no disclosures at this time. With that, I'm going to turn it over to Cara and stop sharing my screen. Thank you so much, Cara, for being here.
Yeah, thank you for having me. If you'll pause with me for a second while I ascend the logistical peaks of starting my timer and sharing my screen, then we can get started. So thank you so much for all of you that are joining us today. I'm always so sad that I can't see, but I know I can feel that there are people in the virtual room with me. So I'm so excited to be here today just to introduce, for those of you who haven't heard of the care mapping process, and also for those of you who have, maybe encourage us all to think about new ways to use them to ascend peaks and navigate many, many valleys, as we know, and connect everyone and everything in between. So no conflicts of interest, and so not important enough to have any disclosures. And as Christy shared earlier, my objectives are just really explaining the process and how I think it can improve communication, collaboration, and care, and just some different examples of different ways to use care maps. So there have been all kinds of maps that have been used in what I will call disability world for kids with disabilities, with genetic conditions, with medical complexity, whatever sort of label and descriptor you want to use for our kids, I'll call them. And different maps like the one here on the left, Path Planning Alternative Tomorrows for Hope, ones that bring together all the people and things and goals and hopes and dreams and medical and otherwise in a child's life and in a family's life, and maps it so that there is some sort of organization and direction. So care mapping is basically the reason I have this. Care mapping is not new. It's sort of a different version of this, and it's really to bring, as I said, organization and a way forward, but it's also really about communication and getting to sort of the whole, getting to the whole child and the whole family, which is the way the models of care are sort of moving more now. Sorry, my computer does not want to move forward. There we go. So it's hanging out for a little bit in the theme of ascending fresh peaks. I just want to stop and pause and sort of think about, so we have all these maps and, perhaps we're mapping alternative tomorrows for hope, or we're mapping how a genetic odyssey, a diagnostic odyssey. I just really want to center us in the fact that care mapping in particular, and any sort of movement in healthcare is really grounded in person-centered care, patient and family-centered care, which for me is my daughter, Justice, who's in the upper right corner here. She's got her little light guiding the way. She is my Bluebird, if you notice from my consulting and my foundation name. Unfortunately, Justice passed away 6 years ago, but she still is my Sherpa, and that's why I have us here in this sort of mountain as if we're in the Himalayas. Just to take you for a second to a particular peak that, in actuality, you are not getting up the Himalaya mountains or any sort of peak of a diagnostic odyssey in healthcare unless you have a Sherpa. And for me, I think that Justice was my Sherpa. She was genetically modified in her own particular way to live her life and lead us down the path or up the path that is her life. And if you see on the left here in the picture, there's a team. You can faintly see there's a rope connecting all of them. I think that, what I'm also trying to say with this is that a journey through, if we're going to use that analogy, a journey through healthcare is not just for Justice, it's not just for her family, but it's for the, primary care team, the large care team of all kinds of people that are involved in the care and the life and the social and the fun of a child. But at the center of it is this child and their family driving which way we need to go and what matters most. And while, certain diagnosis is found and a treatment is recommended, what does that mean for a child and how do we move forward on it? And I really think that it's only with our Sherpa in mind. So what are care maps? This is the original, or the OG care map, I sometimes like to call it, that was created by a mother, Kristen Lind, at Boston Children's Hospital. And she basically sat down at a kitchen table, I'm told, with her primary care doctor and tried to explain and map out to that primary care provider, you say, just go do this, or just take your son to the dentist, or just sign up for Medicaid. But it's not a just. Let me map out and show you all of the people and things and activities that are required to have this kiddo, A, be alive, B, navigate through the world, and C, really have a rich life. The beauty of care maps is that it can be mapping out sort of medical complexity, but also really the social complexity, and begins to give a picture of the whole child and the whole life. Sometimes when we're meeting in the four walls of a clinic office, we can, write an order out for enteral feeds. But if we don't know how those enteral feeds navigate the day, throughout the day with the child, that they go, from the appointment to school, to PT, to adaptive rec, and we just map out an enteral formula and how things go, it's really hard to know, is that enteral order going to be able to follow and move with a child through a life. So a care map is a way to demonstrate all of the things and really open up opportunity for, you missed an appointment. Why is that? And it just it really brings us forward in connection and collaboration in different ways. So a bit about my process. I'll get to what I call the Coleman Chaos Care Map in just a minute. This is a picture of Justice that I'm holding on the day that she came home from the NICU. She was in the NICU for the first couple months of her life. We never found a unifying genetic diagnosis for Justice, but these are, along on this page, some of the diagnoses that she was born with. Some of them were discovered later, but sort of in that, come home from the NICU, how do we move forward? How do we figure out who we need to contact, who we need to bring in, how we are a family? This was actually Thanksgiving Day, so how do we celebrate Thanksgiving now with all of these? You'll see, you see the equipment there, and all of the stuff that she needs to be, grow up and be a kiddo, and how do we navigate all this? And how do we take all this information and put it into a life and be able to share it with, you'll see here, and then also in the map, there were 16 different physicians that were involved with the care of Justice, primary care, and we were not part of a medical home, but our PCP was amazing, and we crafted things together to try to make it as such. But how do you communicate to all of these peoples and agencies and insurers and suppliers and IEP team what is involved, and that they're not the only ones, and that you keep, the reason why I have pictures here too is to just remember and remind that Justice is our Sherpa at the core of this, as well as her siblings and our entire family, because my husband and I really came to believe very strongly that we can do all the medical treatment in the world, but if that gets in the way of living life, it's not really worth it, because you've got to be able to be a kid, and be at the bottom there. You see that was Rasta Justy. That was Justice's last Halloween, in which at the time she was really into reggae music, and particularly Bob Marley, so she was Rasta Justy. So how do we put Rasta Justy into a care map and use it for different communication and collaboration purposes and other? This is a Coleman Chaos Care Map, one version of it that I actually created when I first started teaching in medical school. At the time, I was teaching at Virginia Commonwealth University, and I was trying to think of how to explain and teach about what a medical home is and the need for medical home and the need for care coordination and the need for whole child care and patient family centered care, like the need for all of it. And also communicate just how many people and things are involved in Justice's life. And so I put the picture of our family at the center to remember that that's what it's all about. Justice is our Sherpa, and any decisions we make, any treatment plans, any search for diagnoses, anything that we do is centered around her being a part of a family and her being the extremely social, popular kid that she was in school, and getting there being the most important thing. So usually I make this and I would walk around it and teach and show just the number. There's 16 doctors. At the time, we were between 2 or 3 health systems. There's all these advanced care professionals, support staff, home health, 15 people on an IEP team, 12 different suppliers, 2 different insurances, 10 different agencies. And many of you may be saying, yeah, that's what a care coordinator was for. At the time when I made this for Justice and when she was alive, we didn't have a care coordinator. But now I'm sure many of you have heard that a lot of families say, well, we need care coordinators to coordinate the care coordinators, or that's what families are doing, coordinating 10 of them. So it just adds to the number of people and things involved. And I hope you can begin to see kind of how mapping this out and asking a family to map out maybe a particular issue that they're having around getting supplies or the whole care map opens up a conversation for you as primary care to understand, like, wait, I thought this provider was involved, but they're not. But so what providers are, and what plans of care did they give you, and how can we bring it all together to move things forward? So a few different examples of care maps. I was a part of the Children with Medical Complexity Collaboration Innovation Improvement Network. I probably have the I's switched in there, but anyway, you may have heard of such a network like this. They're called the COINS for short. This was the first one that was focused on, and HRSA funded as well, focused on advancing the care of children with medical complexity. And it was 10 state teams doing over 4 years, and we got an extension for a 5th year quality improvement project. And the care maps that I'm showing here are amidst the pandemic. On the left is a very poor, non-talented artistic rendering that I did of trying to capture what was going on. We were having meetings of all these 10 state teams, and everybody was frantic, like, what's happening with our children? You know, what's happening with the care? Our families getting care? How do we capture? There's so many stories everywhere and everything's, you know, chaotic. And so I did a drawing on the left here to capture that all of the needs are still in there, you know, medical care, care coordination, supplies, home health, everybody's there. But as you can kind of see from that round circle, they're all on the outside in the periphery. And the only connection between them are squiggly lines, which was my poor rendering of the old-fashioned phone lines, right? Any sort of, you know, available by phone, or if people had access to technology, virtual Zoom check-ins and telehealth. Not everybody always had that access. And so just trying to capture all the needs are still there, but there's no access, there's no connection. The picture on the right there, the care map on the right, was that I asked one of the parents there to talk about, because we were having conversations as well, like home health, as many of us know, we are in a home health crisis, although not such declared, although I wish we could declare it as such. Before COVID-19, and now after and during COVID-19, either families were saying it's not safe for home health care providers to come into my home, or they weren't, you know, showing up because they were being paid more lucratively in other jobs, or, you know, just for their own, having to care for their own families, or many of the reasons, right? And so this was one family that had a very complex layered system of covering the care of their son 24 hours a day, with family and paid professionals coming into the home. And so she was trying to capture and describe here for us in the coin, but also then share with her providers, you say that you're covered at home, you say I'm covered at home, but here's what's happening. Here's the, the pitfalls where the holes are coming in the dike and stuff. So these are just two other examples of how really what we're doing here is capturing what's happening in the system, and also the narrative and the story of the family. This is another example of a care map done by a family leader in the coin. On the left here, this is her sweet daughter, Kylie. Her nickname was Smiley Kylie. So this is the last care map that she did prior to COVID, where you can see it's very similar to Kristen Lynn's original care map that's mapping out, all the providers that are involved. Sorry, it's not the best picture, so you can't fully see it, but there's PT, there's OT, there's nurse, there's all of her school things, there's Voc rehab that she was really involved with at the time because she was a teenager, all of the people and things. And then you can see here, after we did the discussions in the coin of, and I showed my really poor rendering of like, now there's everything's on the periphery and there's no access. Kylie's mom went back and did a much more simplified care map that was, showing what she had access to. And you can see from the squigglies, who was the access that is the squiggly line is telehealth. The access that is a straight line is was still in person. And so capturing the different types of contacts and connections, as well as how they were happening, as well as who was, is really different. And so again, you can kind of see, if you have patients and families that are doing care maps or are open and willing to do a care map, they can take what is, tracking what's going on in their life, and then 6 months down the line, after something has changed, or just to check in, they can track and show you what has changed. Or you could look at the old one and map and show any changes that would be helpful for you as primary care providers to understand who's involved, what's involved, why things are working or not working. And that's why I have up here, the quote of "our lives are a PDSA cycle, a plan, do, study, act cycle." That's very much the life of families of children with medical complexity and disabilities. And care maps, having that care map to sort of work off of and have discussions around, really illuminates not necessarily the problems with the child per se. That's really an ableist sort of view of things. But really, if you look at this, it's really illuminating the challenges in the systems that are making barriers, making obstacles, making challenges for how a child gets care, for how a child accesses life and is living their full life, or not a whole child. So the next example that I wanted to give here is, the next example is thinking about how do we take these care maps? Because I think personally that care maps are really underutilized. And I think that there's a lot we can do with taking them to, and I'm going to use a cliche term, elevate the voices of families, right? But it's so much more than that. Often we ask for, in policymaking, in advocacy, in quality improvement, and others, we ask for the voice of families or the story of families. But I think care maps show that it's not just a story. There's a gazillion stories in a care map, right? And most of them are ignored by the system. And a lot of them show us why a system is working or isn't working, or where there's sort of a bend. I often think about systems and my daughter Justice's body through the tutelage of her pulmonologist. It's all plumbing and pipes. And so, if we're looking and thinking about the system that way, we're looking and thinking about, wait, where did the pipe turn? Where there's a clog in the pipe. And care maps do that. So how can we take the just rich and valuable and absolutely critical narratives and instruction of these care maps of what's really going on in the system, and put it into systems level discussions that reimagines how the system works with that Sherpa at the middle. We say we do all that kind of stuff, but a lot of times, and historically, there's been many voices, and the voices of children and families in particular, that have been sort of set aside or marginalized from those sort of systems planning things. And so the blueprint for change that Maternal and Child Health Bureau has released is beginning to think about and mapping and putting in their sort of plan over the next 5 years. How do we take this blueprint for change and actualize it, and thinking about how we do that in a sort of mapping context that brings in the care mapping qualities from families into a systems level. And I have this green arrow here again, just pointing out again that really the center of all of this is our Sherpas, our children and our families. That a system does or doesn't work, or does or doesn't serve someone, all of that moves around the child and family. Whoop. I'm hitting the wrong buttons to advance. I apologize. So, okay, I think I'm here at the end. I'm watching my time. Ooh, I'm going really fast because I worried I would be too slow and late. So anyway, just to recap, and maybe I've gone too fast, and if we move into questions earlier, you can tell me to go back and talk through. So just to kind of summarize again, you know, sometimes people say to me when I've talked about care maps before, you know, and it's usually from providers, you know, saying very respectfully, well, you know, we really can't be in on the care mapping process or do it, or, you know, that is an individual family tool or a child's tool. Exactly true. But it is a tool that a child and family can use to help communicate and bridge those gazillion silos that we know exist. If you look back at the care map, you see, I mean, you can kind of look at it as if it's this map of this field of the healthcare of one child, of justice, that shows all of the silos, 16 silos for 16 different clinicians. How do you bridge that? We say we have things like shared plans of care. Is the plan of care shared across all 16 physicians? I know my primary care provider, or mine, see, look, she was Justice's primary care provider, but she was our family's too, or she still is. Ooh, a little choked up because she was really great. But, you know, for her, half of our appointments sometimes would be checking in on who are the providers right now, and does she have the latest notes from them or any idea of what their plan of care is? Usually she didn't, and so it was my job to bring it in. So how, if we're showing that in a care map, how can we take that to the systems level, but also how can we use it to improve how we're providing primary care so that we have a map of some sorts for all of us to move forward. The sense of chaos is not just for the child and family, but it's also for primary care and the entire care team that is operating in these silos and vacuums. And also, again, I just want to emphasize, you know, a lot of the talk around care maps is, you know, mapping the complexity, mapping the chaos. I use that word, you know, in the title of our map, Coleman Chaos Care Map. I really specifically called it that, and our nickname was the Coleman Chaos, and it was kind of a tongue-in-cheek thing that, you know, gave reference to the beauty that is disability and medical complexity and challenge in that way, the chaos of it that is our family and is our life. And it's also systems that don't work, with more emphasis on the life part of things. And beating a dead horse here, I really think that these care maps can help to bridge gaps. A lot of times families talk, and you hear providers and clinicians of all kinds saying they're talking about X, but we need to be talking about Y. A care map is an opportunity for a provider to take time, which I know is really hard and non-existent in healthcare, but this is a tool that is sort of neutral in a way, neutral but not, because it's around the Sherpa that, you know, helps maybe a provider say, you keep talking about X, why are you talking about X? And then a family, putting sort of emotions aside, can show with this framework of a map, the reason why I keep talking about why this schedule won't work is because her schedule at school is 9 to 3 and this schedule is 4 to 7. That's why. And those are simple, examples and like pulled out of air and probably don't make sense, but we know that these kinds of things happen and that providers and families are not communicating well and not understanding what is going on and where each other is coming from. And so the map gives us the whole picture of what's going on systems wise for a child, social wise, what they need. We often say when we're talking more, and that's a big domain in the blueprint for change, what is quality of life? And people simply say, well, you just measure what matters to families. What is that? If somebody asked me now today, what matters to you? I've given you some of that, right? I told you that my husband and I valued justice being justice at home with her family and going to school above sometimes some of the medical treatments that were suggested or surgeries that would, land her in the hospital for a year. And we use that to balance. But a lot of people can't say, and it's a conversation. It's not just, oh yes, here's my what matters, 1, 2, 3. And so working through a care map really enables a conversation about what matters. And often what matters changes depending on the day, depending on the diagnosis. It depends on how we adjust the system. And also you can see in that ginormous, care maps, there's probably room for cutting down some people and things to simplify life. And that's part of the discussion too. So also, I think I've kind of showed you that it's a quality improvement tool that I think, in a process and systems mapping change tool that we can begin to use, like take this wonderful illustration, description, quality improvement tool that families can create to raise the voice of their family and their experience, but then collectively come together to work as part of teams to make change within a clinic practice or within a state or, some larger thing. And I think that's the one last thing that I just wanted to say. I'm actually at a meeting today where we're doing just that. We're trying to think about how we can take a care map tool and systems mapping tools and kind of put them together as a methodology to really diving deeply and richly into the narratives of families and what is being told in a care map and so much else, and being able to use that for the systems level. And one of the discussions is, but the problem with this is that these care maps are so individual. Yeah, they are, because we're all individuals. Even within the Coleman chaos, you got 6 very rare individuals, right? So how do you map that? But as you map, you begin to see, and particularly if you focus on more of a social model of disability and looking a little bit more at the systems issues, right? The systems issues that bubble up that can be worked on in a QI or a systems change or a policy context really begin to bubble up and be very similar across families. So my family care map, the Coleman Chaos care map, may be different than Christy Weiss's family care map, but I can almost guarantee you and would bet some money on it that if we use them and talk more, within a clinic practice or a regional genetic network, that will be able to bubble up systems issues that we can work on that improve, most importantly, the lives of our Sherpas and honor them so that they can get to that mountain peak, whatever it is, and be great kiddos, and the families and UPCPs and all clinicians and the care team, because the whole health of all of us, I think, is really mapped in these care maps, and they're a compass, just like our Sherpas. So totally running through everything. I'm finishing early. I know I'm supposed to go for time, but if it's okay, Christy, I'll pause for the question part. On the back of the slides too, there's a few resources, a couple journal articles where care mapping is included in it, and some other how to. This Family Voices of Wisconsin Care Notebook also has like a training session, a video module that can be used And then also, if you hadn't read about the Blueprint for Change and some other things, there's links in here for the Blueprint for Change itself and the pediatric supplement that has all the articles that, you know, talk about the different domains in the Blueprint overall and stuff. So if it's okay, I'll stop doing that and we can move to Q&A, and I can talk some more too, because I know we have to do the whole time, but I'll pause for that. So
thank you so much, Cara. That was a wonderful overview and deep dive all at the same time about care maps. We have tons of questions that have come in, so I think we will have no problem filling this time with some thoughtful comments and questions. One comment just to start off the top that came in from our attendees was, as a parent of a child with special needs, I am so glad you presented these maps. It seems so therapeutic to just be able to visually explain and sort out why things are so difficult to manage. So a big thank you from one of our attendees. Yeah. One of the next questions is about how you suggest to best start drawing a care map. So let's talk maybe more about the process of how does a person start to do this, whether that be a family member or a PCP, and maybe you could talk and contrast, you know, both of those approaches of each starting the process.
Yeah. So I actually think the answer, that's my timer telling me I'm at my time. Sorry. I actually think, I mean, my first answer is it's whatever floats your boat, right? Because this is, you know, as you see, I really went different in it. I thought about it a lot. I played with it different ways. And I took that tool that many of us learned in special education, that if you aren't bringing your child to an IEP or a 504 plan meeting, you're bringing a picture of them. So that's what I started with, was my family picture. That's how, as you can see from the pictures in here too, how I think. So I think a lot of it is your own style. But I think the really important thing, well, there's three overarching things and then a suggestion of where to start that will simplify. Because it's also, I just was talking about it with some family leaders last week. And one of them was like, yeah, every time I try it, I get really overwhelmed and I just don't know where to start. And I get that. So one is, what's your style of sharing information? Some people, you can see from the links on there, Family Voices Wisconsin, some people have done some really online stuff. I am not skilled enough to do that, but some people think that way. Some people like drawing, some people like listing, like whatever is your style. The other is, it's an organization tool, like just from that same comment, it takes many iterations. And so just sitting down and writing stuff in groups and buckets before you get to it is really helpful to organize yourself. And the third point, and yep, I'm going to forget what my third point was. Yep. So anyway, we'll move on from my three overarching into my specific, the way that I'm really thinking about it now. I think it might be helpful in, you know, because we're here for a genetics summit, you know, we're likely families and clinicians that are trying to work together to find, you know, on a diagnostic odyssey. So, you know, narrowing down what is the one sort of systems issue, systems search, or family, you know, experience that is most wonderful right now or most troubling that we need to talk about, that we aren't sure of. You know, maybe it's that you have to go for a diagnostic odyssey 3 states away for testing. Just map that. What does that actually mean? Because that's an example of something that we say, oh, just do it, right? Just do it. How do you travel with a child with a lot of equipment, with a lot of medications, with very strict schedules, with siblings, with their school schedules, with family, with work, with, you know, do you have nurse travel? How is it all paid for? I mean, like, there's a lot of things. So really my overarching idea is, if it's too much to start big, pick an issue that's really troubling, or a place or a thing that you're not feeling heard and understood about, and map from there, and you can build. And, you know, just emphasizing again that it's an iterative process. So
great suggestion. Just take a small little step and doing one thing, that's rather than getting overwhelmed with the whole picture. Yeah, great suggestion. These next two questions are similar and related to that electronic piece that you said. So someone gave a comment that there are electronic online ways to build that if that is your style. And they specifically brought up Miro, M-I-R-O, as a possible tool. And then I think this might be from one of our clinicians listening. Do you know if Epic or any other EHR programs have an official care map option integrated within their software on that electronic side of things?
From your lips or text to chat to God's ear, the Epic God's ears. That's a really great idea. I mean, I know that there's been struggle and some people are sort of back-ending how they put on the, like those sort of forms or what get to know me or what's important about me, that's kind of being back-ended in, but I think a care map in there would be great. I've never heard of that happening, unfortunately, but great idea.
Yeah, thank you for that suggestion. And I'll just remind people, last year at our genetic summit, we had a speaker on one-pagers for families. And I think that's what you're referring to, that might be able to be uploaded maybe into an Epic system, exactly. but nothing specific that you know of for care mapping. No. All right. And then another question that's come in is, what types of questions should be asked to get started on a care map? You've touched on this a bit about the overwhelming bit of it, maybe just starting with one question, but are there certain categories or certain questions that a family might ask or a PCP might ask a family to just get the process started?
No, I think, I'm just reflecting on the process I mentioned that I was doing here this morning. We were trying to take really rare neurodegenerative diseases and map out whether or not a medication was approved for them. So we were like, where do we start? If you go back to Chris and Lynn, it's like everything and everywhere. So what we ended up really doing was, we played with two maps, like, here is a child that is 2 years old and still has lower limb mobility. And here's a child, that is older and doesn't have that. So picking a particular issue, in that we picked mobility. So map out, how does a mobility affect your family? What kinds of equipment do you need? How does that work for school? So picking an aspect of the child's life and movement and ability to engage in life, or picking if a child hasn't been going to school and it's coming back to you as PCP and the family's like, we don't know what to do. Map and talk around, here's what's been proposed by the school, here's what we think we need, and you as PCP, what do you need? So mapping around a particular issue really, I think is the way to start. I don't think there's one, but taking that step of, it's again showing the real connection and communication part of it. If you as PCP or clinician isn't sure what's going on in an issue, hey, could you map for me what home health looks like and what's involved? Because a lot of times people don't know everything that's involved in applying for and being approved for Medicaid. And so what does the family know about that whole application process and the layers of people and paper involved? That can all be mapped out if we just focus in on home health only, sort of thing.
Perfect. Thank you for breaking that down. One other question that has come in is first, a thank you for sharing your story of justice and your family's story. And this person's wondering if having a care map improved your initial meetings with new providers when you're establishing care. Did you feel like it allowed for more inherent understanding of your family's values? If you can speak to that.
Yeah, I didn't get to use them. Well, actually there was, because Justice had very established providers when she passed, except there was a switch between one. And he was a provider. We moved from one GI doctor to another, and that was really at her end of life, one of her primary issues, the primary organ driving everything or not driving. And the switch from that really helped us have the value discussions that we needed to have in seeking palliative care and then reaching end of life. So it really gave this sort of, the thing that I'm really into is the quality of life discussions and like that whole picture stuff. And it helped him come on board and bring in the clinical in a new way and understanding where we were and what we were thinking about. So it gave it, if I say, like the family meeting quality that is often, we don't often get to have family meetings. It just brought people together and stuff, and really shifted the whole context. So that's the one example I can think of. But the other thing, just to add too, is, I was saying it's such an organization tool. It helped me continue to be able to think about her care, keep track of her care, and also be able to speak about it, because I'm sure many families will tell you, depending on who they're talking to, like I had 16 different ways of presenting information for the 16 different providers, because I had to learn what they wanted and what kind of information, rather than bringing the whole kit and caboodle, right? And so it just helped me a lot be able to organize, and it's a little bit of the sort of seasoning as you go on in the journey of being a parent and being able to talk about your child. So that answer is a not, but I can totally see how it would be a really great tool. Like, what a great introductory tool, I think.
Absolutely. And one of the on one of your slides in your Coleman Chaos Care Map, someone noticed that you use the term shadow survivors. Could you expand on what you mean by that?
Yeah, I don't know why I put that in there. I've heard of that term before. I didn't know it was in there if it was. It must have been for a talk. There's been some places we're talking, the shadow survivors would be, talking about siblings and my husband and I, really getting to some of the post-traumatic stress that we feel going through, systems navigation, or definitely upon the death of justice. And I think, thank you for bringing that up, because I didn't know that was in there. But it just really, for me, emphasizes again the point of what a care map can get to, either on paper, page, whatever, electronic, or however you're doing it. But really in conversation, that often we just hone in because of how healthcare is set up and pushes financing and time and all kinds of things, but that an order is not just an order for a particular thing. The effects on everyone, including providers, really are shadow survivors. That there is burnout that families feel, and patients navigating these systems, similar to the moral distress and burnout that providers feel operating in it. So that's a lot more than you wanted of my thoughts on shadow survivors, but hopefully that makes sense, that it gives opportunity to talk about the whole picture, not just, the one order or diagnosis.
Yeah, thank you for clarifying that. And a question from one of our providers, saying that it seems like the family is responsible for making the care maps. Is that the intent, or would it be better to sit with a PCP and do it together? And if so, how would you suggest engaging a PCP?
Yeah, I think originally it was created, by a mom for mom to express, but, I don't think there's rules. I think it's a tool, that can be used in different ways. I think it's, it can create relationship, or, you as a provider asking the question, I'm sensing like the valuing and the sort of foundation and relationship that you have with patients and families. And so presenting it as a tool in that way, like, here's what this is. What do you think about this? Would you want to create one on your own, or would you want to work on it, doing it together? I think it can improve the communication that you have with patients and families, in terms of listening to what they say, rather than leading and saying, here's the pre-populated plan of care. Sitting with a blank page and putting down together, like, what do we think is an issue we really want to talk about, and then working through it together. So how to do it, I think, really depends on your relationship and how to present it that way. But I think, trust your gut in knowing whether it's a brand new patient and family you have, or one that you have a relationship with, and how you can present it. But I don't think there's any reason it can't be done together. I just do think the caution is don't draw it all out and pre-populate. We do with plans of care sometimes and do it, because then it's not, unless that's the exercise. I could see that being helpful. That's a lot of the sort of editing that I do and responding to people. Somebody creates a document or an infographic and I come in and say, this doesn't speak to families. This is not my experience. And so I could see somebody drawing, this is what I think is happening in your referral process, in your home health care. And then the family responding, no, 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 no. This is how it happens. And that might be helpful if looking at a blank page is too overwhelming for everyone. So I'm just spitballing my ideas, because I don't think there's any right or wrong way except leading with compassion and relationship and family-centered care, right? With the Sherpa in mind.
That's a great suggestion, especially when that blank page can be very overwhelming to both providers and families sometimes.
Right.
So thank you for that. And another perspective from a provider, this one comes from a pediatric genetic counselor. They say, as a pediatric genetic counselor, I would love to implement care maps for our families. I see this in every results visit that we have as we update on the genetic information. Which part of the care map is most challenging to update?
I mean, I think really it has the most challenging is keeping up to date with a lot of the community resources and referrals, and making sure, because sometimes we start therapy services, PTOT or something somewhere, and then it gets shifted to somewhere else, or it's somewhere else as in another provider. And that's a big shift from one health system to another. And that explains communication, or it gets rolled into a child's IEP. So just checking in on those, the community referrals, because that's also where that's a lot of the care coordination, where a lot of breakdown of things happens, and the load of what families have to do that affects how they engage and how they follow up and partner with their providers. I often talk about and do in air quotes, like, how many times I've been given like, oh, your child needs therapy. Oh, just call this number, just call this person. Like, just, if you think back to that care map, there's no just in this. There's so many people and things, and we know there are wait lists, there are insurance boondoggles and other things. So really keeping track of those community things to see, were you able to call that number? And then ask why or why not. Often we forget to ask why or why not. That's where the real meat of what's going on and what's needed, the real barriers and access and challenges of why something is or is not working.
Absolutely. There is no just in it. Thank you for saying that. That brings us to the end of this session, Cara. I can't thank you enough for spending the time with us and educating us on care mapping today. With that, we just want to thank you for being here, and thank you.
Yeah, thanks for having me. I hope I didn't create more chaos, but feel free to be creative and communicate with compassion with these care maps. So thanks for having me.
For more information, visit mountainstatesgenetics.org/contact. This activity was brought to you by Mountain States Regional Genetics Network. Please enter this code in the evaluation survey in order to claim Genetic Counseling CEU GS23-01.